main part of the brain when you think of a brain. Sits there. Underneath this part right here sits the cerebellum. So right about here is cerebrum. Underneath that is cerebellum. This is the part that is really about thinking. This lower part is about, like Carol was saying, the breathing, the movement, the motor planning. What am I going to do next? How am I going to do that? But you have this sheet of tissue that separates them. You also have one that there may or may not be a picture there that separates the left and right hemispheres. There we go. So some people talk about your left brain or your right brain. There's a sheet of tissue that separates left side from right side, and then cerebrum, the main part of the brain, from the cerebellum, the lower part. But now you take a nice impact here, and this whole system can get shifted, can get torn along the edges, and when that happens, when that happens, the blood vessels are also running along in this packaging. So when you have that impact, you can get a little tear not only of this dural system, these meninges, but you can also get a tear of the vessels. And that's how this bleeding can occur. Trouble is, it's bad enough to have the bleed going on, but because the brain is located inside the skull, there's only so much room in here. You could have an injury to your arm or leg, and it can get very, very swollen. And besides basically the tension of your skin, there's not really a limit on how much space you have there for swelling. But inside the head there is. Even though, and we'll talk about this a little more later, there is some movement of these sutures, these articulations between the bones of the skull. They do give some, but not a lot. So you've got the brain in here, you've got the meninges, and if that starts to bleed, there's only so much room for the swelling to occur. And that's why you're checking somebody's vital signs, you're checking to make sure their condition isn't deteriorating. Because if that happens, if somebody was good an hour ago, and now they're not answering you, or they're taking a lot longer, that tells you that you're getting more swelling in here, you're getting more pressure, because there's really no way to relieve that. And this person's probably also got one half of a headache now, and is telling you that their eyes hurt or their ears hurt, and then they may lose consciousness. But it's because it's a really nice setup to kind of compartmentalize different areas and to protect the vasculature as well. But then when you do get these tears, it can be a problem there.